A very warm welcome today for the joint Fuse research event, which is about understanding the NIHR research portfolio, the public health speciality lead role, and the support that is available to you. My name is Balsam Ahmad. I'm the co-speciality lead for public health in the NIHR Regional Research Delivery Network, and also I'm a consultant in public health at Newcastle Hospital. So I'll be chairing today, and hopefully we will get through in time to leave us with Q&A towards the end. We've got quite a range of presentations, so I'm going to give it now another just maybe a few seconds, and then we will I will start. I've got a few slides to take you through. Okay, so I see. Yeah, please. Hello. Okay, so as I said, this is a joint webinar between the Fuse, the Centre for Translational the Centre for Translational Research for Public Health, the NIHR School for Public Health, the ARC, and the NIHR, the RSS Specialist Centre. We would be today, I'm just going to give you just a little bit of an overview of what to expect in this webinar, and then a few slides, mainly from colleagues from Fuse and the ARC. For today, actually, this is a meeting that is recorded. We are recording just to kind of summarize mainly so it will be available later on, but we won't be with the Q&A. We will keep that. We won't be we will record, but we will not make those available. So they will be only available for you for today. We would expect I think everyone will be muted for today, just to keep it, so the presenters can, we won't have any interference, and the recordings will be shared. A lot of those slides will have links and QR codes, so you can actually go and at your leisure and look at more detail. This is who we are, who's going to be leading this event for today. And this is the agenda for today. So we've got myself as the welcome and a few slides I will take you through, and then we've got 4 presentations before a break. Then we've got another presentation from my colleague Emma about funding before the Q&A session. I don't know if I can a note from the attendees today that you are coming from a wide range of organizations and affiliations. So these are really slides for you just to kind of get an idea of, particularly this is a Fuse research event. So Fuse has been in existence since 2008. It is a world-class public health leads on public health research into policy and practice, and it's a founding member of the NIHR School for Public Health Research. What I would like you to do, and these are all slides will be shared with you so you can actually look at them, and there are QR codes. And this is a really important one for you, just in terms of signposting, how Fuse can help you. And I can, attest to that for even in my own area, Fuse has been of great help for me in my public health lead role in the trust. And I invite you to really kind of connect and scan the QR code once you get those slides. The NIHR research collaboration, I'm going through these really quickly because these will all be shared with you. And this is for the NIHR Applied Research Collaboration. This is just present you with a vision, with the objectives of it. But the most important one is really for you to know that the ARC2 has been funded now until March 2031. there are 4 themes that are really relevant to, you know, for you, whether you're in both practice or research. Those themes are around prevention, including multiple long-term conditions, addressing inequities in health and care system, care improvement and safety, and supporting children, women, and family health. And within those, there are cross-cutting themes. So research capacity development is one, and knowledge mobilization, research inclusion. There's the link here, so please do refer to more details, because these are really, you know, important for a range of colleagues who particularly are working across the, you know, the VCSC or the local authorities or the NHS. So I am going to, without further ado, because I've got only had only a few minutes, I'm going to hand over to my colleague, Kim. I would invite you to introduce yourself and present. Thank you.
Thank you very much. So hi everybody, I'm Kim Shirley. I'm the Research Study Support Service Manager for the North East and North Cumbria Research Delivery Network. I'm just going to see if I can take control of the presentation so I can click along myself, which I think I've managed to do. Is everybody seeing that okay?
Yes, we can actually.
Yes. So I'm just going to quickly go through what the role of the Research Delivery Network is in general, what studies may be eligible for support from the NIHR portfolio, what the offer is at grant stage for researchers and organisations, and then what the RDN offer is in terms of support at delivery stage. So in terms of what the Research Delivery Network aims to do, it's funded by the Department of Health and Social Care, and it's aimed at enabling the health and care system to attract, optimise and deliver research across England. The RDN is just England specific, but we do work with counterparts in all of the devolved nations. So we support the delivery of research, which has been funded by the NIHR, research charities and other public funders, as well as funding through the life sciences industry. We are aiming to build capacity and capability to ensure there is longevity in terms of research delivery. We cover 3 different types of research, public health, social care and clinical research across 4 different settings: hospital, primary care, community and residential. In terms of what they really mean, so community would encompass things like local authorities, schools, prisons, and residential would be care homes, hospices, things like that. So everywhere, really. So in order to be eligible for support from the Research Delivery Network, research does need to meet specific criteria, and I've just popped them up there. I won't go into them in too much detail, but these are the 3 main elements. There are others, but first and foremost, it must be considered research as defined by this DHSC definition, which can be a little bit confusing because when you're working outside of the NHS, the terminology research might not be the same depending on who you speak to in different settings. But this, in terms of the eligibility criteria, is what they mean. It must have full research funding, which means there needs to be funding to cover all research costs in the project. Now, research funding is the biggest part of the eligibility criteria that they check to make sure that you are eligible to receive support. And there are particular funders that are eligible and those that are not. And the difference really is between what we would consider funding awarded through open competition, so grant awards, for example. And then the study must have full approval. And again, this can be a little bit of a grey area depending on where you're working. So if your study does require approval from the Health Research Authority, that needs to be in place. But a lot of projects we work with outside of the NHS might just need ethics review from their university, for example. But these are the main criteria in order to receive support. So I've broken down the support that's available to 2 aspects of the research life cycle. So what we offer at grant stage, the main thing that we get involved with at that early stage of research development is what we call the Schedule of Events Cost Attribution tool. Now, for those of you who have had to do it before, I'm sorry, I know it's a really horrible document to have to navigate, but that's exactly what we're here for, to help with. And for those that haven't had the pleasure yet, if you ever do come across one, then this is something that we're absolutely on hand to help with. We can help with things like early feasibility conversations. So if people wanted to just run their ideas past some different organisations or in different regions, we can help to facilitate that. We can also help people to identify organisations that might be interested in delivering their project. We also have a specific team that looks at PPIE groups, so we can connect you in with some of those groups who can help in terms of their participant and public involvement. And then we also can link you in with people like Balsam and Emma and Fiona, who's going to talk to you later. So our regional specialty and settings leads who can input into research conversations at a really early stage to give you some good advice in terms of running research in particular areas or in different specialty areas. And then also, this is a new piece of work we're doing that Laura Renwick is going to talk to next. And we're going to be working really closely with the Specialist Centre for Public Health Research. And they're currently delivering or developing a pilot health research support for work outside of the NHS in public health. So we're also working really closely with them. And then in terms of the delivery stage, so this is at the point where you have your funding and you are ready to start your research. We offer support from our Agile delivery team. I won't say anything more about that because Fiona is going to talk to that later. We can provide funding for certain cost elements of the project. They're called service support costs. I've put that there because that's a terminology that's used, but really it's that certain aspects of the study for things like identification of participants and consenting, we can provide funding directly to organisations who are doing those activities. We provide ongoing support with things like portfolio management. So part of being on the portfolio, you have to do certain reporting through our portfolio systems, which we can help you to navigate and to do. We also have a really excellent communications team that can provide support in terms of getting the word out there about your research and sharing research nationally. And then as a final catch-all, we have what we call the RDN on request service. So this is essentially anything you could possibly want, come and ask us about, because there's nothing off the table that we can't talk to you about and hopefully provide some advice on, or even if it's signposting you to another NIHR partner or another organisation. So if there is anything else that I've not covered and you want to know more about, then it will absolutely fall under that on request service. So you can absolutely come and ask us about anything. That's all I had to say. I wanted to keep it quite short, but obviously happy to take questions at the end, if that's okay, Balsam.
That's fantastic. Thank you so much, Kim. I think we can move on. And if any questions to Kim, please do write them in the chat, or at the end you can unmute and ask. So I'm going to invite now Fiona. I think you're next on the Agile delivery team. So do you want to hand back to me? I think I can maybe move. Yes, I can. Okay, Fiona, are you here?
Yes, I'm here.
Yes.
Hi,
Okay,
Balsam.
great.
Thank
Okay,
you.
hi. Okay, yes. Do you want to start?
Lovely. Thank you.
Slides.
So hi, everybody. My name's Fiona Yalnorka. I am the Senior Clinical Manager for the Agile Research Delivery team at the Research Delivery Network here in the North East and North Cumbria. I am also the Regional Specialty Lead for Reproductive Health and Childbirth. And yeah, thank you for inviting me to speak to you today. So I'm here to give you some information about our Agile Research Delivery team. And I think often a good place to start is, what do we mean by Agile? We're often asked, what can you do? And I think the answer is we can do pretty much anything depending on the ask. But a little bit about Agile. So we are centrally funded by the Department of Health and regionally deployed. All 12 regional research delivery networks have an Agile research delivery team with the same structure. The intention is that we will provide one service across the country for researchers looking for support to deliver their studies. So we work flexibly across all settings. So Kim touched on the settings before. We talk about hospital, community, residential, primary care, all geographies, so anywhere in the region, and we support all specialties. So I think at the moment we have 32 specialties named in the NIHR, and we support all specialties. So that gives you a bit of an idea. Pretty much anything we can support. We do have a special focus on research delivery in wider care and community settings, and that's in line with the governmental shift of care from hospital to community, and that's really, really exciting. We support all NIHR portfolio adopted study. So Kim has obviously just touched previously on the portfolio and what that means. And we support across the whole lifespan of the study. So we're not just there to come in and support the recruitment of participants. We're not just there to do the setup of the study. We're there to support the whole study across the lifespan. So the Agile team, I'll move on to the next slide. We are a dedicated, skilled, multidisciplinary team. There's about 30, at the moment, there's about 30 whole-time equivalent staff members in our team. And the skill set of that team, oh, sorry, the slides aren't moving. Somebody's just popped that in the comments. Do you need to move the slides, Balsam? I thought I was doing it.
No, I am actually moving them, but I don't know if, and I've synchronized to presenter, so I don't know.
I was moving them too.
Hi, Balsam. The
Which one
slide is still on Kim's last slide for me.
Ah,
Oh, is
right.
it?
Okay, so
which one
we're
can you
on
see
the one
now?
with the one with the photograph of the team, aren't we?
Yes, we are. So is everyone not seeing it? What about you, Kim? Could you not
Balsam,
see?
if I stop sharing, do you want to reshare just in case it's got stuck
Yeah.
somewhere?
Yeah.
It's possible that if everyone syncs to the presenter, if they click on that, then that might sync everyone up.
Yeah, I think that's what everyone should do, but I'm going to reshare again and then share. Sorry for that.
No.
It's still okay for time. So it's going to go.
I'll just leave the slides in your control, Balsam. I won't touch them. Can everyone see those slides moving?
I can now.
Yeah.
Thanks.
Can you see that now on the second slide? Okay, brilliant.
Thumbs
Okay,
up.
that's great. That's great.
Thumbs up.
Fantastic.
No problem. So as I was saying, there's about 30 whole-time equivalent staff members in our team, and our team is a huge, varied group of staff with all sorts of skills. We have managers, we have nurses, midwives, allied health professionals, we have an occupational therapist, a podiatrist, a paramedic. The list is endless. We also have a large team of clinical research practitioners at varying different grades with varying levels of expertise, as well as our research facilitators, research officers, data managers, and of course Helen always gets a name check as our administrator who keeps us all together and in line. So yeah, that's our team. Lots of different skills, lots of different levels of experience, but yeah, really fantastic team. Within the Agile Research Delivery team, we have what we refer to as our research support function. So as well as having staff who go out to sites and locations, so we've got staff who go into care homes, hospices, local authority, family hubs, lots of different places to support the raising awareness of research, engagement in relation to research, and also the delivery of studies. But we have a team, our research facilitators and our research officers, they're primarily there to provide research support for wider care and community settings. So these tend to be the locations that don't have their own R&D department, so they don't have people on hand to provide them with support regarding sort of site engagement, local intelligence, setting up a study, advice that might be needed about governance. So we do provide what we refer to as a virtual R&D office for primary care and for wider care and community settings. And that's really exciting because that enables us to support different locations to set up and deliver research studies that they weren't previously in a position to do. We provide support not only around study setup, but we provide informatics support, we provide funding, which Kim's already touched on, as well as being a really useful link to enable collaboration across organisations, across professions to build those partnerships that we need to deliver the research and to the populations that we're looking to serve. So how do we do this, our delivery approach? So our Agile Research Delivery team has been in its current form, I think we're coming up to almost a year now, and I must admit it has taken us a little bit of time to find our feet and find our flow. But we do have a process that's working quite well at the moment. So our delivery approach is we have a focus upon stakeholder engagement. So I mentioned before our research support function, our facilitators and our officers, they very much focus upon engaging with key stakeholders. So lots of primary care organisations who are new to delivering research and and we're building and maintaining those key relationships, linking them all together, bringing people together and doing what we need to do to deliver the research. We also are very well placed, as you can imagine, to bring in the wider regional research delivery network. So there are other functions within the RDN who can support you as researchers. We've got our data and analytics team, workforce and people team. Comms have already been mentioned. Kim's obviously just mentioned the study support service. There's lots and lots of support available. We distribute portfolio study opportunities across the region. Like I say, we also facilitate effective communication. A key element of the support that the Agile team provide is around capacity development and capacity building within teams. I think, like I said, I've mentioned earlier, in the beginning, I think there was a perception that we were there to come in and deliver the research, and off we go. But actually, the strength in our service really lies in our ability to go into teams and support the capacity development within those teams to enable those teams to go on and deliver research in their organisations. So huge focus upon staff development, making sure people can access training and, you know, whatever it is they need to do, the research that they need to deliver, we can provide that support and the signposting that they need to get where they need to be. So that's a really quick whistle-stop tour of the Agile Research Delivery team. And just to go back to what Kim said, we do have a single point of contact email address that I'm going to put in the chat or somehow get to you guys, because I've just realised that we don't have it on a slide in this presentation, and we should have it on a slide, because our single point of contact email address is the email address that you contact if you require any kind of support from the Research Delivery Network. Even if you're not sure who it is, who you need to speak to, if you contact that email address, one of us will get back in touch. Is there a way of me putting that in the chat? I'll try and do that now. Thank you. Thanks very much.
Thank you so much, Fiona. That's really a helpful presentation. And please do any comments or questions for Fiona, just include them in the chat. I'm going to move on. The agenda. So I'm going to invite my colleague, Professor Emma Giles, who's my co-public health speciality lead for the RRDN. So Emma, the floor is yours, and I'm going to move to the next one.
Thanks, Balsam. So like Balsam says, Balsam and I share the public health role within the North Cumbria region. Balsam, as she introduced in the earlier section, does a lot of public health in the NHS space, working within a trust and beyond. And I'm almost the mirror image of Balsam, working a lot in academic community spaces, but also the NHS. So we make a nice complementary team. And as Fiona's just said, if you have any queries and you're just not sure who to connect to, reach out to either myself or Balsam or both of us, and we'd be happy to move and communicate and share between the two of us. So what is a public health specialty lead? So we're one of a number of leads, lots of different, I guess, topic and condition areas, everything from ageing, children.
Sorry, Emma, I think the slides are stuck on my last slide. Sorry, I just thought I'd jump in.
Thanks, Fiona.
Oh, where are you now? Emma, tell me to the slides.
I can see the public health specialty leads reach to research slide.
Yeah, so is that what everyone sees, or you can put thumbs up? Yes, okay.
So just me. Maybe I need to unsync.
Okay.
Thank you. So there are quite a few different specialties, and there's quite a lot in terms of topic area. So, for example, ageing, children, young people, mental health, general practice. But there's a much longer list. And if you pop onto the Roots to Research website, which is, the link is there, and you'll see. Oh, back a slide if you don't mind, or something. Back 2 slides maybe. That's it. Thank you. You'll see lots of different areas on that Roots to Research website that would be really helpful. And like I say, if you forget who we are, our names are on that website against the public health role. Next slide, Balsam. Thank you. So at the moment, I think from last count, there are 29 specialty leads, and like I say, I've just given a couple as examples, and then 4 setting leads, which are newer components for the RRDN. The settings are community, hospitals, primary care, and also residential. And if you're unsure who to contact, again, the names of those settings leads are on the Roots to Research website. So if you have any queries in terms of a particular setting, they're there to support you, and you can ask whoever you like in terms of the support you need. I can speak for myself. The specialty leads have 1 or 2 hours per week, and we're seconded across from our substantive posts, but we work obviously within the public health research space, and our role really is just to link quite a lot of people together in terms of the regional research delivery network, and also topic expertise. Obviously public health studies span a huge amount of topics and settings, so we can help just to link people as well as offer advice from our own skill set. And all of the leads were appointed through a competitive process, and I believe they're in place till 2028. But as you can imagine, there is some flex with that. Thanks, Balsam. So just pre-event today, we have a lot of people coming from outside of public health, so we don't want to labour this slide too much, but just in case you are new to public health and are wondering what it is essentially, the Faculty of Public Health is just one example of where you could go to find out a little bit more about what public health is and what it encompasses, but there's lots of other websites that you could get that sort of overarching view of what public health is. But essentially, the faculty see it as a science and art of preventing disease, obviously prolonging life, but importantly, healthy quality of life. And that's from throughout society. So almost seeing it as everyone's job really to foster and instill public health. And the public health workforce has a huge amount of work, and they work at local, regional, national and international and global levels as well. And with public health, you've all seen different aspects of public health work, whether that's in the prevention space, encouraging people to maybe move a little bit more, maybe in terms of health protection and thinking about infectious diseases. So I'm sure that we've all seen various public health campaigns over the course of our space. Thanks, Balsam. And then what really Balsam and I can help with in terms of our public health specialty group lead roles are in these main areas. But again, if you're unsure whether or not we can offer support, just reach out. We're both really friendly and really helpful and happy to support. So if in doubt, please just reach out. But essentially what we help to do is to provide the RRDN with strategic oversight. So thinking about those regional portfolio studies and thinking about the ones that are either traditionally managing or supporting specialties, although those terms we're moving away from slightly. And just to make sure that the portfolio in terms of public health is balanced and also representative of the types of studies that is happening on the ground, traditionally in the NHS space, but crossover as well into the outside of the NHS space. As colleagues earlier in the webinar said, we work closely with the Study Support Service because, as you can imagine, there is a fine line between the setup and the design of studies and then the delivery of studies as well. So we work closely with the RSS. And we help to build capacity, a bit like Fiona was saying, and thinking about what are our local needs for research delivery and how can we help support people both now but also in the future in terms of delivery of public health studies. We are networking and advisors for the RDN, particularly obviously around public health and across the region. So we attend national public health specialty group lead meetings to make sure that we're learning from other regions, other RDN regions, and I guess helping support our region with the best possible advice and practice, and then helping to support commercial research as well. Thanks, Balsam. So in terms of our imminent tasks, as Balsam and I have been specialty group leads now for a little bit of time, essentially looking at the portfolio studies and understanding what public health studies are ongoing and what needs they might need, and also shaping those or understanding those needs for future public health studies. Working with our NHS trusts in particular, but spanning beyond that and wider settings to champion public health research and like I say, be ambassadors for public health research, and then link with those other clinical specialty areas and those setting leads to understand what delivery support needs are needed. And I've just popped a few examples of public health studies. There were far too many to add into all of the slides, but I just wanted to give a few examples of the breadth of public health portfolio studies on there, just so you can see the different sort of indicative different settings that public health portfolio studies are in, and also the different topics. So if you're ever in doubt or you're wanting a bit of information on what's already on the portfolio in a general sense, obviously, then we can also reach out and help support with some of that information. So I just wanted to pop a few portfolio examples on there in terms of active awards. And we'll pass over to Laura now, but just to reiterate really that if in doubt, please do contact myself and Balsam, and we'll be more than happy to support you with your studies.
Thank you so much for this, Emma, really helpful. I'm going to hand over to Laura, and we're doing okay for time. So Laura, the floor is yours if you want to introduce yourself and start with the presentation. Thank you. Let me know if the slides are moving as well.
I will do. Thank you, Balsam. Hi, everybody. My name's Laura Renwick, and I'm from a different part of the NIHR, so the RSS Specialist Centre for Public Health, and that is the Research Support Service. Next slide, please, Balsam. Thank you. And it's been really great to hear about the RDN support. And what I'm really here to talk about today is the enhanced offering that the NIHR are providing to public health research happening outside of the NHS. So we're working really closely with the RDN, and we've been funded by the Department of Health and Social Care to scope, design and pilot a research delivery support service to meet the needs of public health research outside of the NHS. And it's about piloting and testing what's needed in practice for public health research for studies that aren't in scope of the research delivery network. So it's recognising that different types of studies might happen in public health that maybe is what is traditionally supported through the research delivery network, and looking at what falls out of that scope and actually what support could be provided to those different types of research studies. There's 4 work packages to the pilot that are going to be delivered over 2 years, and it started in September 2025. And the aim of all of this is to ensure that researchers receive appropriate and high quality support from across the NIHR, no matter what part of the infrastructure that you access, with no gaps to fall through. Thanks, Balsam. So touching on the work that we already are doing very well with the RDN, this is led by Joe Morling, who is the Public Health National Specialty Lead, so works really closely together with Balsam and Emma. And between the RDN and ourselves in the Specialist Centre, we've come up with some ways of working to make sure that for research delivery, what roles and responsibilities, processes and guidance look like for each of us and how we'll work together. And that enhanced delivery support for public health research outside of the NHS is looking at different types of studies, so that research involving the recruitment of individuals will be considered on the RDN portfolio and receive the support that everybody's just been speaking about today. Plus, there's the option to have some integrated support of the delivery pilot where that might be appropriate. If it's public health research outside of the NHS, that is a population level intervention or involves data that sits outside of the NHS and therefore outside of the scope of the RDN, they're the types of studies that we can support within the delivery pilot. So we want seamless cross-referral. We want to make sure we've got a really good joined up NIHR research delivery function that meets both the diverse and complex needs of public health research. Thanks, Balsam. So I'm just going to touch on the Specialist Centre itself. So before we were funded for this 2-year delivery pilot, we were running with 4 different pillars of work. We have what is known as the Research Support Service. We have our Research Design Advice, that second pillar on there, and that is to provide researchers at any stage of their career with advice on research design, funding applications for public health research outside the NHS. This could be the Public Health Research Programme, it could be NIHR Academy opportunities, but any type of public health research happening outside of the NHS can be supported by one of our advisors. We put some direct funding into local authorities, so we fund public health engagement leads, local authority research practitioners. We have some grassroots awards, which we'll talked about later, and public and community partnerships awards, and these are all to support research in local authorities, and for grassroots and the PCP awards into voluntary organisations also. We have a training and development pillar looking to increase capacity and capability within local authorities in different settings to help undertake research and provide evidence on interventions likely to be effective in improving population health. We have a pillar on research governance and ethics, which is really around providing a repository of best practice examples, looking at the different governance and ethics processes that happen outside of the NHS and how we can develop some support options for that. And then we have the delivery pilot itself. Thanks, Balsam. So the 4 work packages, the first of which is scope and what the support needs are for public health research delivery outside of the RDN. I'll talk a little bit to some of the findings from some of the work we've done in this area on the next few slides. Work package 2, we've worked with partners involved in both work package 1 and other stakeholders to produce what the delivery service, the support service will look like. We have work package 3, which is looking at what we already provide within the RSS and the pre-award research design advice and how we can integrate that so it's more of a seamless service. And then work package 4 is piloting the new post-award delivery support service, and I'll talk about timelines for that later. We'll be reporting back to the Department of Health and Social Care at the end of August 2027. And within that, we'll be including recommendations for what the scale, nature and suggested systems for a service could look like and the hosting options for that. Next slide, please, Balsam. So a little bit about work package 1. We've done a lot of work building on and expanding on previous scope, and that's already been done. So within the NIHR, there was some work specifically done with public health research programme award holders around what the challenges have been when undertaking public health research outside of the NHS. And that really helped us inform the types of questions we would ask as part of our scoping. The Specialist Centre also undertook a piece of work around research governance and ethics in local authorities and what the enablers and blockers were, and that was with 60 local authorities in the first year of the centre being open. We've done a scope and survey and had lots of different conversations with researchers and people working in settings outside of the NHS who might enable or support research to happen, and also with our RDN and ICB colleagues. And another thing we've been asked to do is looking at other settings outside of the NHS. That might include local authorities, schools, voluntary sector organisations in the criminal justice sector, and really get, again, an understanding of what the needs for public health research might be there. And we're doing some school research network mapping, again, working really closely with RDN colleagues, but some of that work's really brought to light some of the things that we could do to improve a service when it starts. Next slide, please, Balsam. So some of our scope and findings, I thought it might be just quite interesting to leave some of these on the screen. We had 160 people complete the scope and survey across a range of different audience groups. So we had researchers who've been awarded funding now or in the past to do public health research, those working in settings not in the NHS, so local authorities, voluntary sector organisations. We had representation from schools and nursery, and it's supporting research within their organisation, and also those organisations that provide a research support function. We didn't have any responses from the criminal justice sector or religious or faith-based settings within this survey, so that's something that we'll be looking to explore further as we develop the pilot. And you'll be able to see from those bottom two graphics just the types of people who might work across more than one organisation. So almost a fifth of people worked between 2 and 4 different organisations. So I think it just shows the breadth of where people are working across different types of settings, and actually the difference of what might be needed between those different settings too in terms of support. Next slide, please, Balsam. We also asked people what sort of research they've been doing in the different types of topics. And I think, you know, again, we had over 40 different topics that have been fitted into this slide here. And really just to reassure us that although we're asking very much about public health that's happening outside of the NHS, were people going to tell us about that, or were they going to tell us about all of the challenges? But actually looking at this slide here, we can see that it all is very relevant to this field. Next slide, please, Balsam. I'll not dwell on these too much, but there's some really helpful quotes on this slide just to really give a sense of the different types of challenges I can imagine that there'll be lots of people sitting on this call where these aren't a huge surprise, but you know, these are the things that came through really strongly as challenges for people when they're trying to do research. The comments on the other side, we had so many comments from people who completed the survey that really brought home kind of where the key challenges were, and we're working on those to develop the service. Next slide, please, Balsam. And in terms of top support options, what would people find useful in a delivery support service? Lots of things around the relationship element, lots of technical things like research governance and research ethics, things around skills and capacity and what sort of things might help with those. So again, just some quotes on the other side. But what we've done with this is we've taken it into our next work package as a basis for some workshops that we've now been undertaken. Next slide, please, Balsam. So we have had our first workshop for work package 2, and we have another one on the 11th of June. And we did this to build on those findings from the previous couple of slides, and also from more than 20 different group and individual conversations that we had. And it was moving that focus away from what the barriers and challenges of doing research outside of the NHS for public health to exploring the opportunities for what the service could provide. We also introduced some resources that we're developing within the Specialist Centre for Public Health. So we've developed a local authority costing tool, and we're in the process of developing a public health research interest map. So to give us a chance just to start sharing some of those and to see what sort of support people would like alongside that. We're focusing on areas that were highlighted as being most challenging, and we've used it to develop the foundation for service offerings. So the 3 breakout rooms were around navigating research governance pathways outside the NHS, training needs to deliver public health research, and really those kind of key challenges, but also support options for engaging with organisations to be able to deliver public health research. Next slide, please, Balsam. Our work package 3 is looking at what we already provide as part of our pre-award research design advice and how we can enhance that offering, but also make sure that when our advisors are speaking to people day to day, that they're recognising if potentially there's opportunities to support with delivery within those conversations, and it might be at the stage before an award's even been granted. So it's about that early feedback. We have lots of resource we can draw on now through our LARPs, our FELs, and also our HDRC colleagues who are sat in communities and sat in local authorities who are able to give that really practical advice around whether a research study is going to practically work in that setting, what sort of things that need to be considered, how could they be factored into timelines, etc. We're working closely with the RDN around tools to position studies in the most appropriate geography with the best populations or their environment. And then, as I mentioned earlier, some of the different resources that are being developed within the centre. Next slide, please, Balsam. We're hoping from the 1st of August, we're going to pilot the new service. So with this in mind, it's going to be designed with and to meet the needs of researchers and organisations outside the NHS. It will align with existing support systems in both the RSS and the RDN. It'll test the resources that we're developing within the centre. There'll be a single point of contact and the scheduled checkpoints, and we'll be flexible. This is a pilot, so we're working as we go. We're finding out what's working, what's not, and we're refining the delivery offer as a result. We're also working with the RSS who are developing a post-application offer. So it's support that can be provided to researchers at that point where somebody is either awarded funding or finding out that they've been unsuccessful with their funding application. And that's that type of support. And again, just to make sure that there's a seamless link across all services. Thanks, Balsam. So as I said, we hope to launch in August. And we're also going to have an independent evaluation of the service itself, which will start in December and finish in May next year. And the types of studies that we would like to support, we'd like to say that we've supported a range of different types of studies. So there's 5 examples on this slide that I'll just leave for people to look through. These slides will also be shared after today's session. Thanks, Balsam.
Do you want me to move on those slides?
Yeah, you can do. Thank you. And so our next steps, we will be publishing a report on the scope and survey and the findings from that. We'll also be completing our work package 2 design workshops by the end of June. We are identifying and working with researchers now. So that's to pilot different aspects of what the service might look like and to explore what types of support we can provide at this stage before we launch. And the evaluation, we're in the middle of commissioning that, and that'll begin in December. Thank you.
Thank you very much, Laura. That was bang on time. It was perfect. Really a lot of work that you are undertaking. I'm really looking forward to your report. We've got now a 10-minute comfort break for, and then afterwards we will be coming back to talk about the funding, where Emma is going to take us through that, and the Q&A. So yeah, I mean, if you want to come back at 4:25, sorry, 2:25, not 4:25, because that's like 2 hours from now. Yeah, so 2:25, and if you want to come a bit, yeah, so that would give you just some time to take a little bit of a break. Thank you. People are joining back. I can't see because people have got their cameras off, but we could, Emma, you ready? You're here, okay. So I'm going to move on. Great, thank you very much for giving me the thumbs up. That's fantastic. So we were seeing people coming up back. So we've got the last part of our webinar today and our event where Emma is going to present about the funding and support that is available, and then we can take questions and have a discussion. So Emma, the floor is yours, and I'm going to move the slides for you.
Thanks, Balsam. So just, I guess, really summarising what Balsam and I have been saying, and also Laura in her presentation pre-break, what we really want to, I guess, encourage or emphasize really is that if you're unsure of where to go for support, just reach out to any of us. There's essentially no wrong door, and that if you come in one door and we need to link you across to another one, then we'll do that. So please don't worry if you're wondering who to contact, whether it is Balsam and myself or whether it is Laura over in the RSS specialist centre. So just contact us and we can support as needed. But just as I guess as a summary slide in terms of who might I contact, essentially we've tried to pull together this rather simplistic table, but one that we hope that might help. But again, no wrong doors, so just reach out to any one of us. But essentially, if you are contacting the RDN, it would largely be for research within the NHS setting. However, there is a slight caveat that we also help support research outside the NHS, but it's largely within that NHS setting. And then the RSS Specialist Centre is for largely research outside the NHS. But as you can imagine, in the public health space, there's some blurring of boundaries, and obviously some research spans multiple settings, and it might be both NHS and non-NHS. So in which case you'd be able to get support from any of us. In terms of recruitment to studies, if your study is individual recruitment, then largely the support would be from the RDN. If it's a population level intervention, then largely, or has no intervention, then largely it would be the RSS that would support. But again, we definitely have studies already on the portfolio that span multiple settings and have mixed methods. And that might have elements of population level intervention and elements of individual recruitment as well. So if in doubt, please contact any of us and we can link up and join, and we'll work like what Laura says. Our national lead, Joe Morling, and Balsam and ourselves work really closely all together. So please feel free to reach out. But in simplistic terms, if you're wondering where you fall in terms of the RDN or RSS support, this table might help. Thanks, Balsam. And then really just to keep an eye out for funding. So depending on your role or your organisation, some of these may be applicable, some of them may not. But the RDN offers funding at various points throughout the year. One such example is strategic funding awards, and they are projects that are specifically focused on how we would increase research delivery and also engagement with research. So that could be, for example, appointing someone in a lead role that maybe then champions or fosters new research activity in a particular setting that you've maybe not done before. It could be somebody who would be acting in a lead role that doesn't currently to expand their commercial and just in industry-based research activity. It could be that to deliver some research in the future, you think you might need to foster new partnerships or strengthen relationships between different people and different stakeholders in the healthcare system, and they need a bit of time and a bit of funding to be able to foster those relationships. And then again, another example is leadership time, where you might have to scope something out. So you might want to set up a hub in a particular specialty or clinical area, for example, and you just need a little bit of time and support to be able to do that. So do keep an eye out. We'll be asking on our feedback form whether you wish to join mailing lists, which is one way that we can help to share these funding opportunities. And then quite often they're also on the Roots to Research website as well. Thanks, Balsam. One of the other funding calls which is open currently and has a closing date of the 15th of June is the Green Shoots Research Delivery Awards, and hopefully when you get the slides the hyperlinks will work. So where it says on the right hand side, please apply using the online application form, if you pop into that application form URL, it gives you all of the details around what around what's eligible and what information is needed for that application. But essentially this award in particular, and it's not always the case, but this is available to only the following staff in terms of consultant medical staff, GPs, etc. But like I say, these awards do change. So whilst it may not be a wider pool of people for this particular delivery award funding opportunity, please do keep an eye out, because it's not to say that it'll be the same for the next time. So essentially, Green Shoots, again, increasing research capacity and capability building, particularly looking at future principal investigators or lead investigators, if you like. And the funding is modest, but really helpful for that springboard, if you like, in capacity and capability building. But like I say, I'll just draw your attention to the deadline of June the 15th. And then the Public Health Grassroots Award, I'm sure Laura will be happy to answer any queries on this, but funding is for individuals employed by local authorities in that non-NHS space, and also voluntary and community sector organisations as well. And the funding is particularly aimed at individuals with little or even no prior research experience, and again a modest amount of funding, but it's just really to undertake activities to build that capacity and capability building, research skills, research knowledge and confidence, I guess, as well. So do keep an eye out for those types of funding awards, and again Balsam and I, and speaking on behalf of Laura, but I'm sure Laura would be more than happy to chat through if you're unsure of which funding awards that you want to target, whether you're eligible or who you might need to bring together on an application for it to have a good chance of success. So Balsam and I have definitely supported previous people in terms of these applications, and it wouldn't be that we sit on the application, it would just be offer a bit of advice and then signpost where appropriate as well. So do reach out for those bits of funding as well. And then that's it for me, Balsam.
Thank you. Thanks so much, Emma. So yeah, we are almost on time, which is fantastic as a chair. So I invite everyone, if you want to put your cameras on, if you feel comfortable, anyone who wants to unmute and ask a question or maybe put it in the chat. We've had a few questions, haven't you? Maybe one in the chat that you've answered, I see, Emma. But yeah, this is your opportunity really kind of to ask, comment, or come forward with anything you want to share, really. Yeah, I can't see any more questions. So if there isn't any other questions, I think we've, I hope you found this webinar or, you know, the event useful for the needs that you've come for. And I really wish to thank all the speakers today. FUSE, the Centre for Translation and Public Health Research, for hosting this, and the ARC as well. These slides will be shared, and there will be also a feedback form that will be sent, and we really appreciate the feedback, so it can help us in future events. If you've got any other suggestions as well, it would be really helpful to to get those, so we in our planning for the next event, we could take that into account. But yeah, I mean, if there doesn't seem to be any, I'm looking, people are leaving, so thank you very much everyone, and have a good afternoon. Thank you.